Provide mouth care to a resident who has a denture. A resident is sitting at an overbed table and the resident's denture is in a denture cup. The resident is not able to provide her own mouth or denture care. The resident's denture needs to be cleaned and the resident needs mouth care. The denture is stored in a denture cup after cleaning. The role of the resident is played by a person and you have 12 to 15 minutes for this skill.
Come in.
Hi,
Hi.
my name is Joni. I'm your nurse aide this afternoon. What's your name?
Barbara.
Barbara, can I check your wristband? Thanks, Barbara. Barbara, I've come in this afternoon to give you mouth and denture care. But first I need to wash my hands and get my supplies. And I'll be right back to assist you.
Okay.
I'm washing my hands. Mouth and denture care requires a lot of supplies, so I'll be careful to list each one so that you can understand what you need to pick up before you start providing care. So I'll set up for the denture care first. You're going to start with a paper towel on the counter and a denture tablet. You're going to need a pair of gloves. And you're going to need a towel for the sink. And since you're right here, you might as well get another towel that you're going to need for your resident. The last item that you'll need is the denture kit. And I'm getting that from the bedside stand. For the residents setup, we need another paper towel. She'll need a glass of water and at least 2 toothets with mouthwash and an emesis basin and a pair of gloves. Barbara, some people prefer bottled water over tap water. Which would you prefer?
The bottled water, please.
Okay. I'm getting my gloves now so that I can get the dentures to give care to the dentures first. Okay, Barbara, I'm going to take your dentures now and clean them up.
Okay.
Since I'm going to be touching dentures that are going to go in Barbara's mouth, I'm going to use a barrier, even though I'm wearing my barrier, to turn the water on. The faucet handles are the dirtiest part of this whole project, so I'm going to turn the cold water on. Never use hot water for denture care, only cold. I'm going to take the lid off and rinse that. And I'm going to take each denture out and rinse the food particles off of them. The towel is to provide safety should that I drop the dentures. At least it will break the fall. I'm going to put some water in the denture cup so it can start effervescing after I put the denture tablet in. Okay, hold the denture over the sink, over the towel, and over the water. I use the narrow part for the grooves. And I use the wider part for the wider areas. You need to hold on to dentures quite firmly. They're pretty slippery. If you notice anything about a resident's dentures, perhaps a cracked tooth or an area of their mouth when you took the dentures out that seems like it might be causing them pain, red, swollen, a sore, mention that to the nurse. I don't see anything that I need to report to the nurse about these dentures. They look like they're in fine shape to me. When you're finished, you should put the lid on right away to prevent any breakage should the dentures be dropped. Barbara, I'm going to put your dentures away in your bedside stand.
Okay, thanks.
I used a barrier to open the drawer, even though I'm wearing my barrier, because they do have someone else's microbes from their mouth on them. And I wanted to save those gloves to get the dirtiest part of the whole task done, and that's to take the towel out of the sink. I'm removing these soiled gloves since I put them in the sink so that we can start her mouth care with clean gloves. How are you feeling today, Barbara?
Good, thank you.
I took good care of your dentures. They're nice and clean now for whenever you're ready to put them on.
Thanks.
Barbara, can you put your call bell right down there for now? And I'm going to put this over your clothing in case a little drip gets on it. Would you like mouthwash in your water?
A little bit.
Okay. You watch and tell me how much you want, okay?
A little more.
More?
Yeah, just a bit. Thank you.
Okay, Barbara, we're gonna start with a rinse and then you can spit it in this basin, okay?
Okay. Thank you.
Okay, we're gonna start with the upper gums first, Barbara. Can you open your mouth for me? There we go. Look at the sides of them and the roof of the mouth. I know that's pretty tickly, so let's do another rinse, okay?
Yes.
And then we're gonna spit it right here in the basin. Okay, let's get the bottom gums and your tongue. We'll do that last, okay? Open up. Can you spit that? That's it. Hold out that nice tongue. I heard you're a singer. You need a nice clean tongue to sing. Does your mouth feel clean?
Yes, thank you.
Do you want any more rinses?
No, thanks.
Okay. Let me take care of these things, Barbara. I'll be right back to clean up. Barbara, how does your mouth feel?
Really good, thank you.
Good, I'm glad. Are you comfortable?
Yes.
Okay, well, here's your call bell back. If you need it, just give us a call, okay?
All right.
Can I get you anything? How about a glass of water?
Oh, no thanks.
All right, do you want to read a book?
No, I'm good,
No?
thank you.
Watch TV?
No,
No? All right, well, you have a good rest of the afternoon, okay?
thank you, you too.
Thanks. If you close the curtains, this is the time that you would open them. Okay. I feel like I have done everything that I need to do for Barbara. I'm going to come over and read the card one more time. And I'm going to wash my hands.